Now let's talk about the four nerve plexuses. And a plexus arises when we have ventral rami of adjacent spinal nerves coming together to form interwoven nerves. And these are going to control the skeletal muscles of the neck, the limbs, as well as the diaphragm, which is the important muscle for breathing. So let's look at the four plexi or plexuses. We have the cervical plexus, brachial and lumbar plexus. And the cervical plexus is going to include some of our cranial nerves, as well as C1 through C5. And the major nerve that we want to know about that comes off of this is called the phrenic nerve, which is going to supply the diaphragm. So if you have a damage to cervical segments 3, 4, 5, then you might affect the function of the diaphragm. So a common mnemonic among EMTs and first responders is C, 3, 4, and 5, keep the diaphragm alive. So if a patient has undergone some kind of neck trauma or spinal trauma, that's one of the first things that first responders will look for is the function of the diaphragm and if the phrenic nerve has been in any way damaged. All right, next we're going to have the brachial plexus, and this will encompass C5 through T1, and we're going to have some major nerves arise from it that will control the arm and the shoulder, as well as have sensation from these areas. We're going to have the lumbar plexus from T1 to L4, and the sacral plexus from L4 to S4. And we're going to have a major nerve arising from the sacral plexus called the sciatic nerve, which we have talked about before. And so often if you have damage to any of these nerve roots, then you will end up having a problem with the sciatic nerve and all the dermatomes associated with it. All right, so let's look at the cervical plexus really quickly. Once again, it includes the ventral rami of spinal nerve C1 through C5. This is going to innervate some of your neck, thoracic cavity, and diaphragmatic muscles. The phrenic nerve is the one that controls the diaphragm. It's arising from C3, 4, and 5. So again, a very important clinical nerve to be aware of. All right, this is the cervical plexus. We can see some of our cranial nerves involved as well. And these are going to be the nerve roots of the cervical plexus right here. Now we'll move into the brachial plexus, which is going to arise from the ventral rami of C5 through T1. And several of these rami will come together first to form trunks, then divisions, then cords, which will then branch out into our nerves. And we're going to see 5 major nerves that are of importance. We're going to see the musculocutaneous nerve, the median nerve, ulnar, axillary, and radial nerve. And as their names imply, this is going to give us some hint as to their locations and what areas they're going to serve. So our musculocutaneous nerve will be supplying a lot of our flexor muscles of the upper arm, as well as some of our sensory input from skin over the lateral surface of the forearm. We will see the radial nerve here, which is going to supply our extensor muscles of the upper arm, such as the triceps, and it's also going to supply some of the structures along the pinky side of the forearm, the thumb side of the forearm, the things that are going to be on that radial side. So remember, your radial bone is going to be on the thumb side of your forearm. And then we're going to have our median nerve, which is going to come straight down the middle. As the name implies, it's going to travel between the radius and the ulna. It's going to travel right along the area where our palmaris longus is. And that's going to supply the palmaris longus as well as our flexor carpi radialis, which is right next to it, as you recall. And it's also going to bring a sensation from skin over the anterolateral surface of the hand. And if you go back to your dermatome, you can see exactly where that's going to, which dermatome is associated with that. So then we have got our ulnar nerve here, which is going to travel right along the ulna and supply the distal structures of the forearm as well on the pinky side. All right, so here are our trunks, divisions, and cords. I'm not going to make you memorize them. But now let's look at the lumbar plexus. And we're going to have 3 major nerves that are important for the lumbar plexus. And remember, the lumbar plexus is going to originate from T12 through L4. I'm not going to make you memorize any of these nerves, but suffice it to say, the names reflect the areas that they're servicing. So the genitofemoral nerve, as you can imagine, would be servicing areas of the pelvis and around the femoral region, which is along the femur. All right, so here we have our lumbar plexus, and here are several nerves involved with it. As I say, I'm not going to make you memorize them. But let's look at the sacral nerve. We've got two major nerves that are coming off the sacral nerve that are quite important. The pudendal nerve is going to bring sensory information about the external genitalia and is also going to innervate several muscles of the pelvic region. And then we've had that sciatic nerve, which we've seen before, which travels down the back of the leg, and it's going to branch into a fibular and tibial nerve, which, as you can imagine, the tibial nerve will travel along the region of the tibia, and the fibular nerve will travel laterally along the fibula. So here we can see where the rami of the sacral plexus come together, and we can then look at some of the nerves. And here is our sciatic nerve, and here we can see it basically descending down the posterior aspect of the leg, and here it branches. We're going to have a fibular nerve, which goes laterally, and then we're going to have the tibial nerve, which continues on down along behind the tibia here. Now that we've looked at some of the major nerves arising from our four plexi, or plexuses, let's talk about the functional organization of neurons. So we're going to shift the focus a little bit and talk about the organization of neurons in general and how they can form what we call neuronal pools. So first of all, we have several types of neurons. We've got sensory neurons. These are bringing information from the periphery, and this will be what we call afferent information because it's coming to the central nervous system. We've got about 10 million of these things, and these are bringing information from receptors all over the body. And these will enter the spinal cord and synapse on the neuron cell bodies in those posterior gray horns. So these are going to be bringing all the information about sensory stimuli. We're going to have some sensory neurons that will be synapsing in brainstem areas as well, brainstem nuclei. And we'll even have our olfactory sensation, as you recall, is the only one that bypasses the thalamus. That will be synapsing in those olfactory bulbs. So sensory neurons are bringing information from the periphery to the central nervous system. And we call this afferent. And we usually call this ascending because in most cases, it has to come from the periphery to the spinal cord and then be brought up to successively higher levels. And remember, all of our information that we are going to get from sensory inputs will have to pass through the thalamus, of course, with the exception of olfaction. It's a good test question, by the way. So all that sensory information will have to pass through the thalamus. It will have to ascend to the thalamus for us to become consciously aware of it, where it will then reach the cerebral cortex. And so we call this ascending. Now, motor neurons we call descending, and we've got two types of motor neurons. We've got motor neurons that are going to innervate skeletal muscle, and we have motor neurons that will innervate autonomic structures, things that we don't have any control over, like smooth muscle, cardiac muscle, adipose, these kinds of things. So the visceral motor neurons versus the somatic motor neurons. And the somatic motor neurons will innervate skeletal muscle. And to do this, we have a two-step process. We have what we call upper motor neurons that are originating in brain structures, cerebral structures, or brainstem nuclei that will be controlling skeletal muscles. And then they will descend to some area in the spinal cord and then or other brainstem nuclei, and they will synapse on neurons there. And we call these upper motor neurons because they're located in structures of the head and the brainstem, so the cerebrum and the brainstem. And then these motor neurons, their axons will descend to what we call lower motor neurons. And lower motor neurons will have their cell bodies either in brainstem nuclei or in the spinal nuclei in that anterior gray horn. If you recall, the anterior gray horns contain our somatic motor neuron cell bodies. And so these are the cell bodies of the lower motor neurons. And they will exit the spinal cord, or I should say their axons will exit the spinal cord through those ventral roots and then become part of the peripheral nervous system. And these are the efferent fibers that exit the central nervous system and will innervate an effector. And remember, our peripheral effectors are things like muscles and glands and things that do something. So we've talked about the somatic motor system now with upper and lower motor neurons. We also have an autonomic system that will innervate viscera. So we will have, in that case, we will have a preganglionic fiber, which will originate somewhere in the central nervous system, and its axon will leave the central nervous system and synapse somewhere in a peripheral ganglion, which is a collection of cell bodies. And then that, what we call postganglionic neuron or ganglionic neuron, it has its cell body in the ganglion, will send an axon to its target. And this is called a postganglionic fiber. So once again, this is going to be our effector. This is going to be our efferent neuron that will stimulate our effector. And in this case, the effector is going to be a cardiac muscle, smooth muscle, gland, adipose tissue, or something like that, something that is under the control of the autonomic nervous system. But in any case, we have about 500,000 of these motor neurons. And this is what we consider descending because most of our upper motor neurons or our preganglionic fibers, depending on which system we're dealing with, are going to originate in structures that are higher up in the body and then synapse on nuclei that are in the cord or brainstem nuclei, and then going to deliver commands to these peripheral effectors. Then we have interneurons, which comprises everything else. We find interneurons anywhere where we have information processing. So most of the neurons in our brain and our cerebrum are going to be interneurons. Most of the neurons within our nuclei and our peripheral ganglia, these are going to be interneurons. So these are going to be the things that are processing information one way or another. So they're going to distribute, collate, redistribute information. In the brain, this is going to be what's interpreting information, planning, coordinating the signals. It's going to be collating our sensory information, figuring out what to do with it, and then sending a signal via motor neurons to these effectors to do something about it, whatever it was that we were deciding to do. So neuronal pools are these functional groups of interconnected neurons. They get inputs and they may then do some kind of processing. They may send their output to another neuronal pool, or they might send that output to an effector of some sort. So we see that neuronal pools can be either stimulatory or inhibitory. So for example, when we go back to our basal nuclei, our deep brain cerebral nuclei, these things are going to basically put the brakes on the outputs from the motor cortex. So in this case, we're going to have neuronal pools originating from the basal nuclei that will then inhibit the output from the primary and the supplemental motor areas. All right, so how do these things do it? Well, we have circuits, and circuits are just like electronic circuits. They're just like roads. So as you know, a road can diverge. You can have a path diverged in a forest. Anyway, so I took the one less traveled by, and no, just kidding. So divergence is where you have a breaking off or a splitting off. And so neurons, you could have one neuron that has axon collaterals that reach many targets. You could also have two roads merged together. And so a convergence is a merging. So you could have several inputs or several neurons giving their input to a single recipient, so to a single downstream neuron. You could also have serial processing, which is like a relay that moves through a single line. So one neuron could hand off the information to another neuron, which then hands off that information to another neuron in a serial process. Could also have parallel processing. But for parallel processing, we first have to have divergence, because what we will be doing is we'll be splitting the information along several paths. So we could get some information from, say, a sensory receptor, let's say, and that information could be brought to several neurons that will then process that information, that same information simultaneously. So we would have multiple neurons that are all processing that same information that came from that one input neuron. We could also have something called reverberation, and this is a positive feedback mechanism where the circuit stimulates itself. So somewhere we have a stimulating neuron, it could either stimulate itself directly or stimulate downstream neurons, and one of those downstream neurons will stimulate the original neuron in the circuit. And we'll see some examples of that in just a moment. So here are circuit diagrams. Here we have our divergence. Here we have a neuron that has axon collaterals that are going out to multiple downstream recipients. Here we have convergence, where we have multiple neurons that are sending their signals all to a single recipient. So the downstream neuron in this circuit is receiving multiple inputs from these neurons over here. So this is convergence, where the inputs are all converging to one place. Serial processing is simply where we hand the information off from one neuron to another, very similar to the way a runner would hand off a baton to another runner in a relay. Parallel processing, of course, first involves divergence, where we have to have the same information being conveyed by one neuron being distributed to multiple downstream neurons. And then each of those multiple neurons can do what it will with that information and process that information. So all of these neurons are processing the information they receive from this neuron simultaneously. So we have two sets of parallel processing going on here. We've got this neuron that's sending information to these downstream neurons that are processing it, and this neuron that's sending information to these downstream neurons that are all processing it simultaneously. Finally, we have reverberation. In this case, we have the stimulating neuron that's going, this blue one that's going to stimulate this downstream purple neuron, which will stimulate not only another neuron downstream of it, this pink one, but will also go back and stimulate this blue one again, the one that stimulated it. So as long as the blue neuron is firing and stimulating the purple neuron, then the purple neuron will continue to stimulate the blue neuron so that we have this positive feedback loop. The more the blue neuron stimulates the purple neuron, the more the purple neuron will continue to stimulate the blue one. And this type of circuit is what's thought to be involved in short-term memory. So when you're trying to remember a little bit of information, a piece of information for a short period of time, you might put it in one of these reverberating circuits that can hold it in memory for a short period of time, and then when the circuit quits, well, then the information disappears. And we'll see all of these are important in reflexes. And reflexes are our next topic. And these are automatic responses. And these are usually coordinated within the spinal cord. And we will have interconnected sensory neurons, motor neurons, and usually some kind of interneurons. And we have very stereotyped movement patterns that can be produced from these reflexes. And then we have some reflexes that can be quite complex, that are involving multiple levels of the spinal cord and multiple sets of muscles. And we'll talk about each one of these. But what's important is most reflexes are pre-programmed. So they are automatic responses. You don't have to think about them. You don't have to think about them consciously. In fact, if you became aware of the situation consciously, then your ability to react to it would have already passed. So reflexes are things that happen automatically before you can even think about them consciously. So we've got these basically patterns, these circuits of neurons that have built these circuits to perform these reflexes, and they're rapid and automatic. So we're going to have reflexes being the building blocks of a lot of neural function. So we'll see that basic movement patterns like walking are built on reflexes. And while we are consciously aware and in control of our walking, basically we're just innervating circuits that are already pre-existing. And we just basically use these circuits that are pre-existing, and we're able to build higher motor function with them. Now, our reflex arc is very similar to what we saw at the very beginning of class when we talked about homeostasis. Once again, I'll make you recall that diagram where we had a receptor, which was our thermometer in this case. The thermometer then sent information to a control center, which in our example was our rheostat, or basically our temperature control. And then that was sending its output to an effector, which was, as you recall, our HVAC system, our air conditioning and our heating unit. And so basically what the thermometer gave information about the environment, and then the rheostat or the thermostat would then compare that information to a set point, the desired temperature, and then if they didn't match, it would do something about it to try to bring the temperature back to the actual temperature in the environment, back to the set temperature. So it activate one of these, either the air conditioning or the heating system. Now, the reflex arc works very similarly to this. We have a receptor, and the receptor is going to send that information, afferent information, to usually the central nervous system, so usually some area of the spinal cord, and then sometimes it will synapse directly on a motor neuron, which will then innervate an effector, which is going to be some kind of muscle. So a skeletal muscle, if it's a somatic reflex, it'll be a skeletal muscle. If it is a visceral reflex, it'll be some kind of smooth muscle or gland or something. And so this is an example of a negative feedback loop, because basically what we're trying to do is to counteract a stimulus that's moving us away from homeostasis. So, for example, we can actually let's look at the circuit first. So here we have a stimulus. For example, we have a noxious stimulus, like we have this tack over here, and we accidentally put our finger on this tack and it hurts. We have a pain receptor. So we're going to have the arrival of a stimulus at a pain receptor here, and then we're going to have our afferent fiber. Remember, that signal is going to travel via an afferent fiber in the peripheral nervous system with its cell body and the dorsal root ganglion, and then that's going to synapse on a neuron in the spinal cord. And this is an interneuron, so that interneuron will then send a signal to this motor neuron. And this is a lower motor neuron, so it's going to exit the spinal cord and innervate an effector. So our effector is the skeletal muscle, and that's going to cause the person to pull their hand away from the tack. So basically, they have their hand extended, they put their arm extended, they put their hand on the tack, and so then we basically are going to innervate the flexor muscles, which is going to pull the hand away from the tack. So it's a very simple reflex, and this is what we would call a disynaptic reflex because it's got two synapses in it. Some reflexes, the shortest reflexes, are monosynaptic reflexes, where we have a sensory neuron synapse directly onto a motor neuron. We'll see an example of one of those a little bit later on. But the simpler the circuit, with the fewer synapses, the faster the circuit is. So some of these very basic movement patterns that are going to protect us from harm have very few synapses in them. They're very simple circuits. Now, as we see later on, we can coordinate several of these less complicated reflexes into more complicated reflexes that involve more circuits, but are also going to be a little bit slower. So the more we complicate the circuit, the more synapses we have, the slower the circuit's going to be, and the slower the reflex is going to be. So some of our most important reflexes that are there designed to prevent damage that could happen very rapidly if we don't do something about it are monosynaptic reflexes, and we'll talk about that in a little bit. This reflex here, this withdrawal reflex, is a very simple circuit. It happens to have two synapses in it, but again, it's still going to be quite a quick circuit. At the same time that we convey the signal to the motor neuron to remove the hand from the stimulus, we're also going to be conveying information about that stimulus to the brain. So that first we will withdraw our hand, and then that interneuron will have conveyed some information up to the brain about that sensation to let us know, hey, there was something here that was noxious. So we're aware of the situation, but by this point, we've already taken our hand away from it. So we've already withdrawn from the noxious stimulus hopefully before it can do us any damage. All right. So we have ways of classifying reflexes. Some of them are innate. So that means you're born with them. They develop either before you're born or shortly after you're born, and this is just the natural consequences of how the nervous system is going to wire itself. We also have some reflexes that develop later on, and these are called acquired reflexes, and these are things that are learned. So, for example, if a deer runs out in front of your car, you put on the brakes, or if someone runs a stop sign in front of you, you put on the brakes, and you've done it before you can even think about it. And this you have programmed yourself when you learn to drive. You weren't born with this reflex. It didn't program itself automatically because, we aren't born knowing how to drive. We have to learn that. But by the time that we have become competent drivers and very experienced drivers, we have already programmed this reflex into ourselves so that if something runs out in front of your car, you'll slam on the brakes even before you're aware of anything else. We can also talk about the type of reflex by what type of motor effect that it's going to, I should say, what kind of motor effector it's going to stimulate. We have somatic reflexes, which are going to innervate and stimulate somatic skeletal muscle. And we also have autonomic reflexes that are going to innervate smooth muscle and glands and things of this nature. So we can also categorize them by the complexity of the circuit, and we'll talk about several neural circuits that are increasingly complex as the reflex itself becomes more complex. And also the site of information processing. We can have spinal reflexes where all the information processing takes place within the spinal cord, or we can have cranial reflexes, which are going to take place, as the name implies, within the cranium, so within the brain or the brainstem. So the cerebrum or the brainstem.